I overdosed twice, and the second time I overdosed, I had stopped breathing, and EMTs told me that I was dead when they came.
You just heard from one of the fortunate individuals who managed to survive not one but two overdoses and is now in recovery.
So here in Clark County, 345 people overdosed in 2014. 394 OD'd in 2015. Last year, 372 people died.
Already this year, 108 people have overdosed in Clark County, a very serious epidemic gripping our area and the nation. That's why we're talking about it on this Overdose Awareness Day.
Joining us now is Dr. Joseph Bradley, creator of Solutions Recovery Chronic Pain Program. Thanks so much for being here, Doctor. We appreciate it.
Thank you for having me.
Let's get right into it. So many people think about drug overdoses, as we were just talking off air, a syringe in the arm, cocaine, things of these, the kind of typical, stereotypical drug. A lot of this is prescription-based, prescribed by a doctor.
Yeah, what happens is there's multiple entries into this arena. A lot of times people will have a legitimate condition that requires an opioid pain medication, and they simply like the effects beyond that of just reducing the pain. They can develop a tolerance, and when the pain medication is no longer doing the trick, can increase their dose or getting the drug illicitly, or turn to other more lethal drugs such as fentanyl, things of that nature.
Doctor, the coroner's office says there's been an uptick in deaths involving heroin. We were looking there as well since 2013. Why? What's contributing to these overdoses at such a rate?
Well, here in Nevada, the majority of, just to go with like heroin, for example, the majority of heroin that comes into Nevada are coming in from Mexican cartels. And what they do is they lace heroin with fentanyl. Fentanyl is a synthetic opioid that's 50 to 100 times stronger than heroin. Literally 2 milligrams, that's barely a pinch of salt, can create an overdose. And so a person simply doesn't know what they're getting. They can be used to taking an amount of heroin that their body is adapted to. Suddenly it's laced with fentanyl and it's lethal.
Fentanyl can be 50 times as powerful as heroin in some studies. Again, heroin coming from the Mexican cartel. What do people do if they have surgery and the doctor wants to give them an opioid prescription painkiller, but we know that can lead to this? What do people do?
Well, as with all medications, there's a legitimate need and a legitimate time. I mean, post-surgery, the body simply doesn't heal well under stress. And being a civilized nation, being in pain really isn't something that we should have to deal with. It's really not the legitimate usage of it, but rather the abuse of. What we need to be more aware of is having a more cohesive system to where we're seeing if people are doctor shopping. When we see that there are higher amounts of an opioid pain medication being prescribed than what would be deemed normal for a particular condition. We need to have better tracking systems from almost a legislative level. But on more of a home personal level, there needs to be more of awareness from families in recognizing that a loved one may be falling into this trap of drug addiction.
So whether it's illegal like heroin or the abuse of prescribed medication, how can they get in touch with you or someone for help?
Well, we have a number, Solutions Recovery, 1-800-822-9147. You're immediately going to be met with an admissions counselor that's going to take you through this process, help you to identify what you can do. And here's the nice thing about it. When you're talking about the number one health concern in the United States, and certainly here in the state of Nevada, how many things that have that type of value are free? The call is free, the initial assessment is free. Okay. And you can actually then determine from a licensed professional if you meet criteria for a use disorder.
Right.
Thank you, Doctor. It's called the Solutions Recovery Chronic Pain Program. We appreciate your time.
We do.
Thank you very much.
Thank you.